And Remo, I'm going to ask you this question. It follows what Lisa has just been talking about. And so one of the audience member asked, do you know of any cases of people on biologics who are diagnosed with COVID? Would their prognosis be worse? So kind of like Lisa was talking a little bit about Xeljanz, but what about the biologics?
Yeah, so I think that Lisa sort of touched on this a bit. I think that we need to think about a few things. Number one is, are you at increased risk for developing or being infected by the virus? And certainly, I think in patients who are immunosuppressed, we think that there is an increased risk, and that's why we have some of these recommendations that are on the CCC website. Now, certainly, when you are infected and you develop the disease, there's no real good evidence right now that you may have a more severe course. I think in general, we think that depending on the mechanism of action of the drug, that may be associated with a worse course. And I think in the last two webinars, we've talked about sort of the secure IBD registry. And if you look within that registry and you look at the distribution of patients and their course, there's really no signal within the registry that patients who are on, say, an anti-TNF therapy or some of the immunosuppressants are actually doing worse than patients that are on mesalamine. There's some slight early signals, but I think we should be very, very careful with that, with interpreting those early signals, because the numbers are still relatively small. So I think the general recommendation is that if you develop the disease itself, then you should probably stop systemic immunosuppressive therapy, and then you should alter the dosing intervals of the biologics until the disease has actually run its course. But to Lisa's point, is one of the things that we believe may lead to more severe disease is this concept of cytokine storm, and that's why drugs like IL-6 inhibitors and or the JAK inhibitors may actually sort of temper that. So it's complicated, and again, I think if you get symptoms, the most important thing is to talk to your gastroenterologist to get some guidance around that.